Hi, I'm Abby Phelps, and this is my first video, and I will be going over the National Asthma Education and Prevention Program. All right, so what is NAEPP? The National Asthma Education and Prevention Program was initiated in 1989 to address the growing national health problem of asthma, which remains a significant problem today. According to the latest data, nearly 25 million people in the United States, including more than 6 million children, have asthma. The National Asthma Education and Prevention Program Coordinating Committee provides a venue for conveying diverse stakeholders with an interest in improving asthma management in the context of current standards of care. So what are the goals of NAEPP? So first goal is to raise awareness among patients, health professionals, and the public that asthma is a serious chronic condition. Ensure the recognition of the signs and symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals. Ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs. And then fourth, enhance the quality of life for patients with asthma, reduce the burden of asthma, and reduce the number of asthma-related deaths. So at a glance, so the NAEPPCC expert panel developed clinical guidelines known as the Expert Panel Report 3, which we'll go over here in a minute, for the diagnosis and management of asthma. Selected topic areas in the EPR 3 for the diagnosis and management of asthma were last updated in 2020. What resources has the NAEPPCC developed? So they first developed and widely disseminated the guidelines for diagnosing and managing asthma in 1991, followed by the revisions in 1997, 2002, 2007, and 2020. The most recent update to these guidelines, the 2020 focus updates to the asthma management guidelines, provides guidance on 6 selected topic areas, and we'll go over those. The NAEPP's former National Asthma Control Initiative engaged diverse stakeholders to bring asthma care in line with evidence-based recommendations. NAEPP and the NACI, resources for patients with asthma and their families and for health professionals are still available. So the expert panel report 3 guidelines. So the goal of this asthma care quick reference guide is to help physicians provide quality care to people who have asthma. So quality asthma care. So quality asthma care involves not only initial diagnosis and treatment to achieve asthma control, but also long-term and regular follow-up care to maintain control of patients' asthma. So not only short-term, but long-term control depending on the patient and severities and stuff like that. So asthma control focuses on 2 things. So reducing impairment, the frequency and intensity of symptoms and functional limitations currently or recently experienced by the patient, and 2, reducing risk, the likelihood of future asthma attacks, progressive decline in lung function, or for children, reduced lung growth, or medication side effects. So achieving and maintaining asthma control. So here for the things that we look over. So providing appropriate medication, depending um, on your patient, their severity, things like that. Addressing environmental factors that cause worsening symptoms, helping patients learn self-management skills, and monitoring over the long term to assess control and adjust therapy accordingly. So initial visit diagram. So we're going over 5 things: diagnose, assess, initiate, um, develop, and schedule. So first, diagnose asthma. 2, assess asthma severity. 3, initiate medication and demonstrate proper use. Um, develop written asthma action plan, and then schedule follow-up appointments to see how your patient progresses with medications and other things. Right, so continuing with that, so follow-up visits, going over 5 things. So assess and monitor asthma control, review medication techniques and adherence, assess side effects, and review environmental control, maintain step up or step down medication, review asthma action plan and revise as needed, and schedule the next follow up appointment. All right.